Why should more people get involved in the HPG is a really good question. It's very easy, like politics, to sit back and have a complaint or criticism or a concern about what is or what is not happening.
Without community involvement, the decisions about how we move forward, the kind of interventions that get developed, the kinds of initiatives that are put in place, would be in the hands of fewer and a smaller number of people, many of whom are not necessarily connected to the communities that are impacted.
The more voices we have at the table, the more likely we're going to have a diversity of experiences and opinions, and maybe we'll get that aha moment, that thing that kind of like takes us over the top.
I believe community planning and HIV prevention is important because you can't have one without the other. I think because of the diversity in the face of HIV and AIDS changing, the community has to be involved in the prevention aspect of it. And if the community isn't, then the prevention won't be as effective as it could be.
We need more people involved. I think we need to branch out and include others who have not historically been involved in this work. But I think the more communities that we can engage outside of the HIV prevention establishment, if you want to call it that, the better, the faster I think we'll move towards that goal of ending the epidemic.
I believe that more people should get involved in HIV prevention because it is a public health concern and it is a community concern, and I think that the thing that should spread is not the virus, it should be knowledge, and that can only be through a concerted effort of people who care about not only their bodies, but other people's bodies and other people's health. I think getting involved shows a level of concern for people other than yourselves that's really important.
I think that some of the young people we work with don't often know that they can be represented in this kind of work. And I think to some degree, there's a thought process that happens with young people that, they don't have the tools to make a difference, or that one voice can't make a difference. And so one of the main reasons I joined the HPG was to change that perspective, especially for the young people that I work with, that you can have a voice in this process. It is affecting our communities. You can get involved.
You have to think about the National HIV/AIDS strategy that was recently, in the last few years, implemented, which is very important and I strongly support. But also I fear with more national attention given to HIV prevention, the community voice might be lost. I feel already sort of a weakening in terms of support for the community voice in HIV prevention. So I think we're going to have to work really hard to keep the community voice strong and influential in HIV prevention planning.
This is your opportunity to get your voice heard, to make a difference. Your vote matters, and even like politics, you can do something that will make this ultimately a better place to live, a better place for your community, a better place for you, and a better place for your patients. So show up, take responsibility.
For more information about the New York City HIV Planning Group, you can contact us by phone or by email, follow us on Twitter, like us on Facebook, or watch us on YouTube. Please subscribe. We hope to see you soon.